All right. Good evening. Welcome to a special meeting of the Stillwater City Council for March 18, 2020. I'll call this meeting to order. Thank you all for being here. Thank you all for tuning in. Those of you that are watching online, this is probably one of our more heavily viewed meetings in a while. As you can tell, we're sort of spread out here. We want to try to maintain our social distancing as we've been asking everyone in Stillwater to do over the last few days. Point of this meeting, the only item on the agenda tonight is to hear reports from me and from the city manager and from a few of our community partners who are here today about sort of the current situation, actions that have been taken to this point, and some discussion on what other actions are going to be necessary and what we're looking forward to setting up for our community. So I wanted to start tonight just by talking through kind of what's happened over the last few days here in Stillwater. Starting on Sunday, we issued our first emergency proclamation due to a positive test for a COVID-19 case here in Payne County. Here in Payne County is the only information we have from the health department on these cases officially. So if we did have additional information, we would certainly let folks know. But at this point, the health department is not releasing very much detailed information about any positive cases. But based on that positive case, we did issue an emergency declaration for the city of Stillwater. It included canceling events citywide at city facilities, closing certain city facilities, including the library, the senior center, the community center, and various other places, and then also issuing strong guidance for folks to avoid group gatherings at that time. Many of our churches here in town for the weekend didn't meet. And then on Monday, we issued our second emergency order. It was really sort of a clarification for some of our public safety personnel, fire department and police department who operate under a union contract. We just made it clear under that emergency order that some parts of those collective bargaining agreements relating to scheduling and some of those issues that we were going to have to address as we move forward here would be suspended and potentially some changes made. Our fire and police personnel were certainly on board with that and understand those changes. One of the other sort of odd things that came up in the course of that was personal grooming policies around our officers having facial hair, because the masks that they may be asked to wear in responding to situations going forward can be compromised. The effectiveness can be compromised by facial hair, and so we had to change some of those rules. I noticed Chief Watts had already shaved his goatee. I've been considering shaving my beard as well in solidarity with our police and fire department personnel, but it's a tough thing to ask somebody to do. So we'll see. I may do that here shortly. But and then on Tuesday, we issued a third emergency order that went to officially limit gatherings in the city of Stillwater to 50 people or less, and then to strongly encourage no gatherings of more than 10. We also issued an order closing restaurant seating areas, closing bars, entertainment venues, gyms, really sort of what we've seen on the advice of medical and public health professionals as areas where it's very difficult to maintain social distancing, and where activities that could promote the spread of the virus in those settings would be particularly dangerous. And so those are the orders that were issued on Tuesday to take effect on Wednesday morning, this morning. I want to say to everybody out there who's been affected by these orders, business owners, employees, how much it hurts all of us to have to make these kinds of decisions, and how difficult it is to tell a business owner that they have to close, and to tell a server or a worker at one of these entities that they may not be able to go into work the next day. That has not been an easy path for us. It's been a lot of discussion and talk about what the alternatives might be. But I think it is abundantly clear at this point in our community here, in our state, and nationwide and worldwide, that the spread of this virus is an urgent public health crisis that we've got to take aggressive action to try to stop. And that's been the actions that we've taken so far. I did want to ask City Manager McNichol to talk to us a little bit tonight about the steps that have been taken here at City Hall regarding city employees to make sure that we're keeping our city employees healthy and able to continue to run the essential functions of the city, and also public and first responders. Mr. McNichol?
Oh, thank you, Mayor. We've been at work since this whole thing broke in terms of ensuring that essential services continue. And I want to talk for a moment about what we consider essential services. First is water. You can't live without it. And along those lines, Monday night you will see a resolution. I asked the utility department to not disconnect anyone for non-payment starting Monday, and to continue that until the SUA can act, and you'll see a resolution on that. One other thing that we kind of thought of after the fact that I think probably the council kind of wanted to find out if the council wants to consider is removing, at least for some period of time, the 10% surcharge for late fees. So, okay, we will bring that to you Monday. So water, electric, wastewater, waste management, police, fire, and emergency management, we believe to be our essential services. And we have asked every department, whether it's considered essential service or not, to take a look at their staffing and come up with a plan so that we ensure continuity in everything that we do, particularly, though, public safety and the utilities. And what we have developed is kind of a rolling schedule where for 2 weeks, and we picked that very specifically for the 14 days, 2 weeks, a group of employees will be at home. They will be on call. They will have access to email and phone, and they will be working from home when they can. The other group will be here carrying out the daily activities of the city. And at the end of that 2 weeks, those groups swap. And we would continue that until this crisis is over. We also have redoubled the efforts at sanitizing this building, and doorknobs and surfaces and bathrooms and everything that you can possibly imagine to try to cut down on the possibility of someone contracting it and passing that along to the other employees. So that plan will start on Monday. Police and fire have similar plans. We have worked out an arrangement with Payne County Jail for those people that absolutely have to go to jail. Those folks will be placed in, they have a positive pressure system there, and they will be placed there. And we are keeping our municipal jail absolutely as empty as possible. And in fact, the matter is citing and releasing all those people that we can, except those that might commit some kind of felony or violent crime. It's not a license for somebody to go out and do something silly, but those are our plans that are in place. We also have every director working on and have developed a 2-week rolling plan in addition to staffing schedules of work for the city as this thing progresses. And as we see other things break in this situation, we have asked them to look 2 weeks in the future, formulate a plan, and during that 2 weeks that runs up to the end of their plan, to continue to update that plan as they go, so that we hope we have absolutely every contingency covered. And I think at this point,
well, I'll jump in at this point, Norman, and just offer my overwhelming gratitude to the city employees so far that have been dealing with these issues and trying to figure out how to move forward and working on contingency plans and emergency plans. I know it's been a few days of a lot of work and a lot of planning and figuring out how to deal with the current situation. So we certainly appreciate all the work that you and your staff have done moving forward. Councilors, any questions for Norman about plans or staffing at this point?
I want to reiterate that I am really proud of all of our employees. They've jumped in and risen to the occasion and faced this situation head on. So,
good.
Pleased with their work.
So on the issue of utility disconnects, just to reiterate what you said, the Utilities Authority right now, under just your sort of instruction, is not executing any sort of disconnects, and then we will, as the SUA, look at that issue on our regular meeting next week to formalize whether we want to adopt that policy.
We actually have the resolution prepared with the exception of the addition of the 10% fee, and we will add that, and actually Mr. Dorman will add that, and we'll bring it to you Monday night.
Okay.
Is that resolution going to include not only the delay of cancellation of services, but what about people that don't have service that need it? I mean, if we're going to be asking people to stay home, is there any kind of provision for people to have services turned back on that is not on currently?
We went back through those, and to date have not found any of those.
Okay.
So we've crossed that bridge, and would do that if people would just call.
Yeah.
So.
And who should they call if they do need a service enacted?
742 the customer service here at the city.
Okay.
That was 742-8221.
Right.
221.
Thank you. I've noticed, just not city related, but I know that ONG, Oklahoma Natural Gas, also indicated that they wouldn't be disconnecting services for late payment at this point. And Suddenlink also indicated the same. Suddenlink and Altice, their parent company, had also indicated that they were offering free broadband connections for any home in their service area, which would include Stillwater, of an elementary or a K through 12 student or a university student that does not currently have internet access. They are willing to offer free broadband connection right now for folks. I know we'll be talking about the schools and what's happening there. The university had announced today that they would be online for the rest of the semester. So if there are students in the community that need access to broadband, Suddenlink has offered to do that, make that connection. I posted some information about that, but I'm sure if you go to Suddenlink's page, or we'll make sure on our resources page also that people have an update and figure out what can happen there. Can you give us a little update?
Sure. We have a number of Can you hear me now?
There
Okay. We have so many helping agencies, and I enjoyed calling all of them, or as many as I could. The best probably summary of needs or needs for agencies, and if you need help, would be the UnitedWayPayneCounty.org. And they have a great list on their website. You could also call their office number, 405-377-2161. We know that a big barrier to wellness is the reluctance or inability to ask for help. So we're all in this together. This is something unprecedented for any of us. Do not hesitate to ask for help. A big boon to wellness, of course, is offering help, and this is also on the United Way website. Churches, every church is opening doors, has volunteers, has services, has special money funds. So access churches. I think I just mentioned the AT&T stay in contact with people. Zoom has just zoomed off the charts because everybody's doing Zoom and FaceTime, and it's really a helpful thing. Of course, my bias is mental health, and so I am very into the idea of staying connected. Visit Stillwater and the Chamber of Commerce, although not actually social agencies, are both working on very extensive lists of businesses, restaurants, nonprofits, and their hours, whether they deliver or do drive pickup. If I may, I'll just offer a couple of other things about staying in the present. Don't what if yourself into a tizzy. Acknowledge what you're feeling. Anything that anybody is feeling, shock, denial, anger, bargaining, is pretty normal. And acknowledging it and talking to someone about it is very helpful, even if it's on Zoom. Avoid re-traumatizing yourself. I decided this afternoon that I was continually traumatizing myself, reading every single article that came across my iPad about the virus. I think I know enough. Stay inside, stay away from people. Establish a routine. Get up at a regular time, get dressed, don't stay in your jammies. Try to think of some kind of a goal for the day, and eat well, sleep as well as you can, exercise, and go outside, even if you just are sitting on your porch.
That's really helpful, Pat. Thank you. You brought up one thing around social service agencies. I know, Norman, when we talked about closing the senior center and the community center, there are a number of, Project Heart, one of our senior nutrition programs, operates out of there. Could you let us know kind of the status of what they're doing?
Yes, sir. Both mobile meals are forging ahead. They've provided information to their drivers about how to protect themselves while they're doing that wonderful work. And Project Heart is also both delivering and having people come by and pick up. And again, that most of the people that are served by those services are our most vulnerable folks, and their nutrition is very important. One other thing I forgot to mention, our marketing department has been working overtime, pushing out information both about the situation, about the proclamations, but also that helpful information that's out there. We found a Department of Commerce page and several other things where people can go and get help for their small businesses to get them through this unprecedented time. So, and we will continue to do that. So it would be good for everybody to sign up for Be Informed Stillwater.
Yeah.
I think 211 is also a good resource. Yeah. They have a good list of things. Our Daily Bread is also working, and they are doing boxed food, and it's drive by, pick up the box. So your choices may be limited, but you will get food, and they're willing. They're serving anyone at all.
Okay, thank you. So we do have a few community partners in the room, folks from the medical center, from the schools, from OSU, from Meridian Technology, who we kind of invited tonight just to maybe present a little bit about what the status is for each of their organizations and what we as a city might be able to do to help, or just things that we need to be aware of. I don't know what the plan is on the podium up here. Scott, would you like to kick us off? Scott Petty from Stillwater Medical Foundation has been kind of appointed by the medical center as the liaison to the city to kind of keep us updated on a continual basis of what's going on over at Stillwater Medical. So we appreciate you being here, Scott.
Thank you. Thank you, Mayor. Thank you, Council. Thank you, Pat, first, for your comments about mental health and the importance of that. That's very valuable and helpful. I'd like to thank the cooperation with Norm McNichol and emergency management for their outstanding assistance and cooperation. And especially I'd like to thank our courageous healthcare providers for their service and being on the front lines at this time during this serious public health matter. Beginning on Friday the 13th, we established our Incident Command Center at Stillwater Medical Center to work to limit the spread of COVID-19. We activated that command center 5 years ago. So this reopening the book and taking a look at what we need to do to protect our community and take care of the citizens is a little different this time, obviously. But we want to do everything we can to communicate how to flatten the curve and the spread and potential spread of this serious situation. So social distancing and quarantine, if you believe you've been exposed, is very important. In an effort to blunt the impact and like I said, flatten the curve, we want to strongly advise our citizens to honor that social distancing. This, along with regular hand washing, will limit the spread. So I'm going to give our website a few times for the community members, because this is a very fluid situation. Things change. I left the hospital at 5:45 to make sure I went through some comments, and then Dr. Wedlake mentioned something that was not news yet, but I will mention that as well. Or I got permission to mention that as well, I should say. But giving our website will maybe help with guidelines and recommendations for the community. So check back frequently if you're wondering what's new. But that's stillwater-medical.org/services. And we've got a banner there that we're updating regularly. I want to mention, if community members have surgical, medical, dust mask, we are asking for those. Oklahoma State University gave us 1,000 of those this afternoon. We are limited by the supply chain, and we're not the only hospital. It's just the way that it's going right now. So they're slowly trickling to us, but we're not in a dire situation, but we could use more. So if you've got some, we will accept those on the 12th Street campus. Don't take them to the main hospital, but you can take them to the Stillwater Medical Plaza, which is at 1201 South Adams. It's where my office is, but take them to the front door, and there's someone there that knows what to do with them. So we want to strongly encourage you, if you have a fever, if you have a dry cough, if you have shortness of breath, call your provider, call your clinic, call the urgent care first. We're requesting that people not go to the ER. Obviously, if it's if you can't breathe, go to the ER. But we do not want to spread to other healthy people that may be in an urgent care in a clinic. So call ahead, let them know you're coming, let them know your symptoms. They will probably come out to the car and meet you and assess even further whether your situation will require a COVID-19 test. If you are administered a COVID-19 test, it takes at least 48 hours to get those results back. Fortunately, here in Stillwater, we still have no positives, so that's positive for us. But those that have been tested, we absolutely encourage you to treat those people as if they may have that. So whether that means quarantine or special social distancing, please keep that in mind. They're going to be probably going home rather than being admitted, unless they have underlying health issues. Eventually, and this may be weeks away, but we're already assessing how this might work. But we are working to figure out how to have a parking lot COVID-19 test station. That will not be at the hospital. That will not be at the main hospital. If we get to that point, we will advise and share where that will be. And we just ask for your patience and calm with that, because it'll be a new situation. And if that action warrants, we'll advise the community. If you traveled or are traveling at spring break, it is strongly recommended that you self-quarantine, especially if you've been out of the country. If you've been to states that have high positives, You're going to want to self-quarantine and just self-check, depending on those states. Just be aware of those symptoms that I mentioned earlier. So self-monitor your situation and don't go overboard, but we need to be aware. As far as visitor information at the hospital, right now we're limiting visitor hours 10 a.m. to 8 p.m. daily. You must be over 18 to visit. Visitors to the hospital and the clinics will be limited to one support person at a time, and we'll ask that everyone undergo a temperature check as they walk through the door. There's only 3 entrances right now: the main entrance, the ED, and one construction entrance off to the further east, to limit that, to kind of limit access and make sure that we're adequately controlling that. We're also limiting the use of our waiting rooms, and we'll encourage social distancing and encourage 6 feet between people. This is very, very important. Just a special thanks to several of our community members that have already stepped up and provided masks and different supplies, and even the little shop of flowers brought by flowers. But Derringer's Kicker, Fastenal and Kuninen's, Razuk's Drug have all contacted us, and if there's others that would like to know how they can help us, will please contact us at the hospital. As I said, this is a very fluid situation, and so to stay up to date, check out our Facebook page, Stillwater Medical Center Facebook page, as well as that website again, stillwater-medical.org/services. So with that, I did not mention the thing that Dr. Wedlake was just advised between the time I left the hospital and the time I got here, that surgeries will be paused at I'm sorry. You want to explain, because you're the one that got the communication, and I did get approval. There's a good press release that will be coming out, but I don't have it yet.
Yeah. So as far as what are called elective surgeries, so these are surgeries that are not urgent or emergent in any way. Those will be put on hold for the duration of 1 month. At least this is my understanding as of 20 minutes ago. So elective surgeries will be on hold. That does not include emergent surgeries. So as Mr. Petty said, if you have a medical emergency, we still would encourage you to go to the ER, and you will be triaged and assessed if there is indeed an emergent condition. So emergent surgeries and procedures will still be taking place, but those elective surgeries, to be defined as those that are not emergent, those will be on hold for at least the next 1 month.
Much better stated than a medical professional than myself.
Scott, we really appreciate your help with this and being sort of our liaison, and I know you and Norman and you and I and lots of other folks have been chatting quite frequently to kind of keep abreast of everything that's going on, and we certainly appreciate you and Denise and everyone at Stillwater Medical who are working so hard to stay ahead of this situation.
Thank you. It's a team effort, and you know that. Those of you that have been around the medical community and Stillwater Medical, that incident command center has so many different leaders and doctors coming in and out of the room throughout the day, and they've been there 12 to 14 hours a day every day since Friday. And we'll continue to be as long as we need to be. So appreciate the comment and appreciate the time.
Thank you.
Okay.
The capacity of Stillwater Medical, especially and our local healthcare providers, to deal with new cases as they come in or sick people as they come in, if this virus does continue to spread, is really my main concern in dealing with the emergency orders we've dealt with and the decisions we've been making. I think the thing that we want to avoid the most is for the medical community here in Stillwater to be overwhelmed by too many patients coming in at once. And that social distancing and the slowing of the spread and the flattening of the curve, as Scott mentioned, is really the major goal here, right? This virus will run its course through our population at some point. The slower we can make that happen, the better for our medical providers in our community. And that's why it is so important, whether you're sick or not, to stay away from other people and to slow down the spread of the virus. So again, thank you for being here, Scott. I think we have Dana Renner from Stillwater Public Schools, who's the Assistant Superintendent for Operations, to kind of give us a little bit of an update on what's going on with the public schools at this point and what we can expect there.
Good evening. Thank you for having this meeting tonight, and thank you for the introduction. My name's Dana Renner. I am the Assistant Superintendent of Stillwater Public Schools. We have been working sort of from a threefold scenario as we process through the guidance that we're receiving from the State Department of Education, but also wanting to work in partnership with the City of Stillwater, OSU, Stillwater Medical. So right now our approach has been to prioritize needs. So our highest priority at this point is during the timeline that we have been given, that we know of today, we want to make sure that our students are taken care of while they're not in school. So we have established a child nutrition plan where we will have breakfast and lunch available to any child in the Stillwater community age 1 to 18. They don't have to be a student of Stillwater Public Schools, where we will provide breakfast and lunch. So we have 6 school sites that will be open. The sites themselves won't be open, but we will have a drive-through pickup process where parents can come through to get a breakfast and a sack lunch. The sack lunch would be for that day, the breakfast would be for the following day, and then they can repeat that process the next day. We also have a delivery service where we've established 9 locations within the community where we will have buses drive through and stop for those that might be able to come and collect. If they can't make it to one of our sites, we felt like that was a good opportunity for us to have a walk-up service as well. That information has been shared out on our website. It's been sent via email to our internal parents, but I also can leave it here tonight, and you guys can maybe share it on your website as well. So that's kind of step number 1 for us. Step number 2 for us is really responding to our staff, making sure that our employees understand that we understand the emotional side of not being in school with their kiddos, and also for our support staff, the insecurity of not really knowing what not working looks like for them in their world. So we've communicated with our staff kind of about our internal plan in reference to that. It's similar to the City of Stillwater in reference to essential functions and job tasks. So we've been working through some of that. Lastly, safety is kind of our primary third focus area in reference to, once we've identified those essential functions and we know which staff members might be present on site, how do we keep everybody safe with the guidelines that have been provided? Ideally, we don't know how long this could go on. We are working within our 2-week window right now that's been established from the State Department of Education and the framework that they've shared with us. We also understand that that is fluid and things are dynamically changing every day. And so not looking too far ahead, but being prepared for what could come, but kind of staying focused on where we are right now. So those are our 3 things: meal service to students, employees of Stillwater Public Schools, and their security, just so that they're not stressed about their own personal livelihood and situations that could be affected by them not working, and then safety. So
Excellent. Thank you so much. We
Absolutely.
appreciate that.
Like I said one more time, we've shared all that information out. We are accessible through email, so if community members or parents or students have questions, email is the best way right now to reach anybody within the district, whether it's a teacher, a counselor, a principal, a district administrator. Our website is where we're updating most information, but we are using our internal communication processes as well that we have set up with family members and students so that they're current. Yeah.
Great. The child nutrition piece of this is so important, and the work that your team there has been doing is really just phenomenal. I mean, in terms of being able to do that and provide that level of nutrition to the children in Stillwater is a huge benefit, and we really appreciate all the work that's going in and has gone into to making that happen. I noticed on your post, like you said, it's available 1 to 18, no matter whether they're a student or not. There's no paperwork. You don't have to show up and qualify.
Regardless of socioeconomic status, there's no qualifiers, so anybody.
Anybody who needs it.
Truly anybody. And I appreciate you saying that. And I just should reiterate, too, that, you know, teachers, as everybody knows, they're not in the profession for the wealth and notoriety. They're in it because they love kids and their heart is doing what's best for kids. So our child nutrition workers, our transportation workers are ready and waiting to find a way to plug in and connect with our kids. You know, we miss them. We miss not getting to be with them. So, yeah.
I never thought
We're
I would
happy to
hear my
help.
kids complain about not being able to go to school. But they really are concerned
Now we know,
about not
yeah.
seeing. I mean, they want to be back. So we appreciate you being here
Of
and
course.
for the information.
Happy to. Thanks.
Thank you.
Thank you.
Doug Major is here from Meridian Tech, as another educational institution here in town with tons and tons of folks who rely on you guys. I'd love to hear what's going on over there.
Okay, well, thank you for the opportunity to come and give an update. And like everyone in the room, the plan is changing moment by moment. But one of the things that we recognize is that on a daily basis, under normal operations, we bring people in from at least 5 different counties around Stillwater. And we know that that's not good in the current situation. Our campus is closed and has been closed since Friday. Normally, we would work a skeleton crew over spring break, and we didn't do that this week. And so our campus has been completely closed since Friday. We've also canceled all classes, day, evening, community classes through at least April 6th. That has to do a little bit with the State Department of Education, but also with the proclamations that you all have made, and we certainly want to follow those. We will resume with staff only on Monday, but we will not be open to the public. The external doors will be locked, but we need to begin looking at what curriculum we can offer online and continue services. And there are a couple of reasons for that. Many of our programs lead to a licensure or certification, and we have students who are nearing the completion of that. For example, a cosmetology student in high school has to document at least 1,000 hours of training before they can sit for their state boards. We have students that are very, very close to that, and if we're not able to continue services online in some way with them, it'll jeopardize all the work they've done for 2 years. We also do a lot of workforce training in the area of health and health related, and we all know that the need for that continues and will continue, and so we need to try to figure out how we continue offering training in programs like Certified Nurse Assistant, Medication Administration Training, LPN. And so we've got a lot of work to do in that 2-week window that we've been given that says we can be closed with staff only to do planning. And when we may open again for limited classes. We will work with our business and industry partners, and if there is a class that they absolutely need, we will try to make arrangements to make that happen. We will respect the group size of 10 or less, and so we won't have classes that involve more than 10 people. For a lot of people, our terrace restaurant is something that they look forward to. That is closed indefinitely for now. And we will not be offering takeout meals through our terrace dining. And so just want people to know that as well. And then we're also, like Stillwater Public Schools, certified staff is pretty well taken care of in statute during times like this. Support staff, it's not quite as defined. And so we will be working to ensure as much as possible that our support staff has work to do that allows us to continue to pay them so that they can continue to provide for them and their families during this trying time. And so, again, our website is where we will post our updates. For our students, current students and staff, we do have an emergency notification system that we're also using, and so we will keep as much information out there as we can. Thank you for the opportunity.
Thanks, Dr. Major. Appreciate you being here. And as Dr. Major said, I mean, the speed at which our educators in the state are having to try to adapt the teaching that they do to a new paradigm is not easy, and we'll certainly appreciate the fact that that work is being put in and trying to.
Our students and the people of the city of Stillwater. We did extend a message today at approximately 3 o'clock, and I'll read just some excerpts from that message from President Hargis, obviously making top of mind the safety of our students. But we are moving in Stillwater and Tulsa campuses. We'll deliver online courses only for the remainder of the spring semester. All of our students, faculty, and staff did receive this email this afternoon, and so for those watching on television, if you'll just refer to that page, whether you're a student or a faculty member, there is a link in that email to our ITLE program. So if faculty have questions about extending online education, that ITLE link is there. In addition to that, we are strongly encouraging a reduced occupancy and on-campus housing for the rest of the spring semester. And as President Hargis said, it's a difficult decision but necessary to protect the health of our entire campus community. Specific information for on-campus housing residents is being mailed specifically to those students. So if they have questions about when and how they can move out of our on-campus housing, it'll be addressed to them specifically. In addition to that, we are engaging with students to consider alternatives to our traditional spring graduation program. And as that information becomes available, we will extend that to our students, faculty, and staff. And then lastly, I'll add that just in an effort to strike a balance between core services of the university and the safety of our faculty and staff, we have implemented a telecommuting program, and if those watching have questions about that, they can refer to their supervisor about who can telecommute to make sure that we're also extending core services to the university. Thank you.
Thank you, Kyle. We appreciate you being here and providing that additional detail. That is those 20-some thousand students that have mostly been gone this week, may return over the next few days. That is certainly one of our concerns with just the virus itself and some folks who have been out. And I think Scott mentioned earlier that for anyone who has been traveling, certainly into higher risk areas, the state of Colorado and all of their ski resorts have been identified as pretty high risk. I think Florida and some of those places that are popular for spring break have been identified that way. If you are a student and coming back to Stillwater after spring break, please take those precautions to self sort of isolate, check your temperature, make sure that you're not coming back into the community with something that someone else here might catch. That is a concern, I think, for all of us. Whether you're a student or staff that's been traveling or families here in Stillwater that have gone out over the last weekend and this week. So I think that's all the community partners we brought in for tonight. I know we've been working with folks at the county and the county health department as well. We will be continuing to work with them. Maybe at our meeting on Monday might have some more information to talk with them about as well. Counselors, any questions from any of this information here tonight or anything that you feel like we haven't spoken enough about? A couple things that just popped into my head. We have been talking with a number of these community partners, with the health system, Stillwater Medical, about the potential necessity of childcare, especially for first responders and for healthcare workers. For those critical populations that we're going to need to be on the job with their students potentially out of school for a couple weeks, or hopefully not, but maybe more. Elaine has been helping kind of coordinate some of that. We feel like we're on the right track with making sure that we're going to be able to provide those services. I know a lot of folks in town are going to have issues with that, but we are going to focus just on those first responders and the healthcare professionals that we need to ensure are able to continue those services. And so we have been working on that issue. Another issue, Councilor Chalosky, that was brought up today was Spanish language communication. We have a large Spanish-speaking population here in Stillwater. We've been working with a couple of local partners. In fact, someone from KOSU actually brought that up to me today and reached out about translations and translators. And so we're working on making sure that all of our information is available in Spanish as well. So just those are a couple of the issues that popped in my head. Any other issues that you all have been thinking about or questions that you might have to make sure, or questions you've been getting from the public that we want to make sure we address or anything like that at this point?
When you're talking about travel, Mayor, it made me wonder if there are any changes at the airport that you're aware of.
The only change that I can tell you, there are precautions that they are taking there,
Okay.
as every flight
As every
boards or
airport is.
departs at the airport. Numbers of passengers are way down. They're way down. And we've been visiting with the airlines. They're seeing that nationally. It's not just Stillwater, Oklahoma. People are concerned about flying and concerned about the destination where they are potentially going. And it is so severe that the government's looking at a fairly large program to prop up those airlines.
In any other circumstance, those numbers would be bad news, and they're not certainly something that we are happy about right now, but in the grand scheme of things, it's actually somewhat reassuring to see that those numbers are down. That means less people are traveling and less exposure to this virus, so just to throw that in there.
A couple of other issues that have popped up I saw just from a national perspective. I've had some questions about evictions. Those are not legal issues that are handled through the city. But I did see that the president today made an announcement about attempting to delay or prohibit evictions and foreclosures during this time of national emergency. I'm not sure about the details there. Certainly locally, our court system is not hearing court cases and jury cases and that sort of thing, so we would not expect that to be an issue. That's another issue we will address certainly the county sheriff who is involved in that process, but it is being looked at, and certainly folks who are concerned about not being able to pay their rent or their mortgage during this time, I think that issue is being addressed both at a local and a national level. So I think in sort of closing for this meeting tonight, again, I appreciate the community partners that were able to be here. Certainly appreciate all the folks out there who have been watching online or on TV. This has been a really difficult few days, and it is going to be a very difficult few weeks. I don't think any of us is under the impression at this point that this will be over quickly. We've been talking a lot we've talked about numbers and sort of what positive cases are out there. And at this point, we are very pleased with what we're seeing in Stillwater. But at the same time, I don't think we're under any illusions, given the lack of adequate testing at this point, that those numbers will not be higher as soon as those tests are available and are being processed a little quicker. And so, the actions that we've taken at this point and the strong message that we are sending about social distancing is based on the fact that we don't want this virus to spread any more than it may have already done so in Stillwater. We need to limit that spread and to flatten that curve and to allow our health system the time it needs to keep up with this situation. And so, again, these are difficult decisions. These are not things that the city at all, or certainly me personally, I have any desire to make the kind of decisions and issue the kind of orders we've issued. But our first priority is the health of our citizens and the safety of our citizens, and we will continue to make the decisions that we feel is in their best interest. And so, we're always available by email on our social media accounts. I'm mayor@stillwater.org. The counselors are all counselor and their last name at stillwater.org. We're always happy to hear your feedback, your comments, whether it's positive or negative. If you want to let us know what you think, please do. And we're trying to take all that feedback into consideration as much as we can as we go forward. But I would just reassure you at this time that we are working as hard as we can to make the best decisions we can to protect the health and safety of our community here in Stillwater, and we will do that as long as we need to. Councilors, is there anything else at this meeting, or is there a motion to adjourn?
Motion to adjourn.
Second.
We have a motion and a second to adjourn. Would you like to call the roll?
I will. Mayor Joyce?
Yes.
Vice Mayor Darlington?
Yes.
Councilor Zanati?
Yes.
Councilor Rayleigh?
Yes.
Councilor Jalaski?
Yes.
With a vote of 5-0, the Stillwater City Council meeting is now adjourned.